Ladies and gentlemen, dear committee members and dear colleagues, it is my honor to introduce Mátyás Vezér, our new candidate, defending his PhD dissertation today, and it was also an honor to be his supervisor during his doctoral work. Dr. Vezér was graduated from Semmelweis University as a medical doctor in 2018 and has completed his specialist training in 2024. He started his PhD work, as you mentioned, in 2021, and he's currently pursuing his doctoral degree at the Department of Orthopedics together with the Translational Medical Center. Throughout his doctoral training, Dr. Vezér has demonstrated exceptional scholarly and professional accomplishment. He has published several papers in high-impact international journals such as Gait and Posture and Journal of Clinical Medicine, which is reflecting the quality and relevance of his research. His achievements has been recognized with the Nándor Zinner First Place Award from the Hungarian Orthopedic Society in 2021. In addition to his research and clinical duties, Dr. Vezér is actively engaged in teaching, regularly mentoring medical students, and assisting in orthopedic training sessions in both Hungarian and English language. Dr. Vezér's dissertation focuses on the evaluation of novel rehabilitation methods for children with cerebral palsy, specifically robotic-assisted gait training and video game-based therapy. His work is distinguished by a dual approach. On one hand, he has conducted rigorous systematic reviews and meta-analysis to synthesize the existing evidence for these cutting-edge therapies. On the other hand, he emphasizes clinical application, exploring how these innovative rehabilitation techniques can be effectively implemented to improve patients' outcomes. This translational perspective ensures that his research findings are not only theoretically robust, but also directly relevant to patient care. In summary, Dr. Mátyás Vezér exemplifies the ideal of a clinician scientist, merging innovative research with dedicated clinical services. It's a great pleasure to have him here today to present and defend his PhD studies. Thank you very much.
Thank you, and thank you for the introduction. And welcome to everyone. My PhD thesis, Novel Devices in the Rehabilitation of Children with Cerebral Palsy. My name is Mátyás Vezér, and I work at Semmelweis University Department of Orthopedics. My vision is strengthen the faith, the quality of life of children suffering from cerebral palsy that can be improved by novel rehabilitation methods, and therefore my mission is to clarify the indications and roles of innovative methods in the rehabilitation of children with cerebral palsy. Let me introduce my two articles. The first article's aim was to evaluate the effectiveness of robot-assisted gait training. It's a systematic review and a meta-analysis. And my second article purpose was to assess the effect of video game-based therapy to improve appalling function in children with cerebral palsy. Cerebral palsy occurs by the damage to the developing brain, which may cause movement disorder. CP is the most common motor disability in childhood, and its incidence from 2 to 3 out of 1,000 live births. One of the most difficult tasks in pediatric orthopedics is to improve the quality of life of children with cerebral palsy using different methods. My first article title was Evidence for Gait Improvement with Robot-Assisted Gait Training of Children with Cerebral Palsy Remains Uncertain. Maintaining physiological walking is not a challenge for healthy individuals. However, in children with cerebral palsy, walking may need a huge effort due to the subsequent pathological gait pattern. In ambulatory children with cerebral palsy, improving gait is usually in the main focus, and there is no existing evidence that robot-assisted gait training would be better than other rehabilitation methods. Therefore, our aim was to investigate the efficacy of robot-assisted gait training. Our clinical question was, can robot-assisted gait training improve gross motor function with children with cerebral palsy? Our population was children with cerebral palsy, intervention, robot-assisted gait training, comparator, a conventional therapy and outcome, a gross motor function measurement D, gross motor function measurement E, and temporal space gait parameters. Our aim was to evaluate the effectiveness of robot-assisted gait training on gross motor function in children with CP compared to other forms of rehabilitation. We have started the systematic search in 2021, 1st of October, with the search key in the following 5 databases. And at the end of the selection process, from 7,366 articles, only 13 articles were eligible. My first forest plot about gross motor function measurement D, improvement in percentage. Gross motor function measurement D is a 39-point scale system which divided the patient according to their standing abilities. According to gross motor function measurement D, we did not perceive any significant change. My second forest plot about gross motor function measurement E, improvement in percentage. Gross motor function measurement E is a 72-point scale system which divided the patient according to their jumping, running, and walking abilities. Regarding gross motor function measurement E, we did not recognize any significant change. Our search forest plot about gait speed improvement in meter per secondum. Here we can see 0.1 meter per secondum improvement in favor to the intervention group compared to the control group. Our fourth forest plot about cadence. Cadence means step number per minute, and here we can see no any significant change. Our fifth forest plot is about step lengths in meter. And according to step length, there was no any significant change we can perceive it. From these results, we can conclude that the robot-assisted gait training has a positive impact on gait function. However, the improvement is not significantly higher compared to the effects of conventional physiotherapy or treadmill training. The exact role of this treatment in the rehabilitation of children with ambulatory cerebral palsy therefore still remains unclear. Our article strengths could be that we obtain a biomechanical information about gait development through robot-assisted gait training, and the limitation is the heterogeneity of the population and the study methodology. Our implication for the practice could be, despite a significant therapist and parental pressure, there is currently no evidence-based proof for the additional effect of this therapy. And our implication for the research could be a more homogeneous patient population, and additional randomized control trials are needed to more accurately determine the effect size of robot-assisted gait training. My second article title was Effectiveness of Video Game-Based Therapy to Improve Hand Function in Children with Cerebral Palsy. It's also a systematic review and a meta-analysis. Children with cerebral palsy usually have a variety of motor impairments of the affected upper limbs, such as muscle weakness, spasticity, and incoordination, which may cause dramatic function loss, for example, in reaching and grasping. Video game-based therapy thought to be as effective as usual care or conventional physiotherapy. Therefore, better rehabilitation and result can be achieved through increased compliance. Comprehensive studies regarding the effectiveness of video game-based therapy in upper extremity rehabilitation in children with CP are limited. Our clinical question was, what is the effectiveness of video game-based therapy on upper limb function in children with cerebral palsy? Our population was children with cerebral palsy, intervention video game-based therapy, comparator conventional therapy, physical therapy, or absence of treatment, and our outcome was grip strength, grasp function, hand function test and questionnaires, and manual dexterity. Our aim was to investigate the efficacy of video game-based therapy to improve, to compare the other traditional forms of therapy. We have started the systematic search in 2024 with the search key in the following 5 databases, and at the end of the data selection process, from the 2,882 articles, only 24 articles were eligible. On the first forest plot, we can see grip strength. In order to pull the data, pull different measurement scale, we use standardized mean differences. According to grip strength, we cannot observe any significant change. Our second forest plot about grasp function, where we can see a large significant improvement in favor to video game-based therapy group compared to other forms of rehabilitation. Our third forest plot about manual dexterity. According to manual dexterity, there is no any significant difference between the examined groups. Our fourth forest plot was about upper limb fine motor function, where we can see a small significant improvement in favor to the study group compared to the control. And our fifth forest plot about hand function questionnaires, where we can also see a small significant improvement in favor to the intervention group. From these results, we can conclude that the video game-based therapy may be an effective tool for rehabilitation of disabled upper limb function in cerebral palsy. And in terms of upper limb motor function tests and questionnaires and grasp function, this new form of treatment, when complemented with other therapy, is superior to conventional forms of rehabilitation alone. Our article strengths could be that we were also able to pull the data from different tests, and the limitation is the heterogeneity of the population and the study methodology. Our implication for the practice could be that due to the potential benefit of video game-based therapy and the absence of reported harmful effects, it may be worth considering the use of this treatment as an additional tool to other traditional therapies. Our implication for the research could be that further investigation should be conducted, in which only video game-based therapy is included to investigate its independent effect with more homogeneous outcomes. Let me introduce my additional activities. That we have adapted a parent-reported outcome measurement tool in the Hungarian CP-CHIDE, and we recommended the use of the validated form of CP-CHIDE in our institutional protocol to assess the role of these innovative therapeutic forms. And let me show my scientometrics. And I would like to express my gratitude to those from I received a lot of support and encouragement during the preparation of my PhD. And I would like to say thank you for your attention with this quote: a person who never made a mistake, never tried anything new.
Thank you very much. And the talk is now open for discussion. And first of all, our opponents, please raise your questions.
Thank you, Mr. President. First of all, I'd like to congratulate to your job. Actually, we all orthopods know that cerebral palsy patients have a complex problem. Neither surgical, I have some limited experience in surgical methods for CP children from the past. Neither the surgical methods nor physiotherapy, including your rehabilitation methods and conductive pattern method, conductive education, they have no proper solution for this problem, unfortunately. Going through your thesis, going through your publications, quite a few questions raised up, and these questions connected to number one, long-term effects, number two, role of motivation, combining with the traditional methods, age-related differences, some barriers, of course, there are a few, and about the future directions. Let's start with the first subject concerning the long-term effects. Many rehabilitation interventions focus on short-term improvements. Based on your findings, do you think robot-assisted gait training or video game-based therapy can produce long-term functional benefits for children with cerebral palsy?
And thank you for your question. It is convincible that with sufficient and forced repetition, the movement could become ingrained in child's routine, thereby improving gait as for robotic-assisted gait training. And as for video game-based therapy, predicting its long-term benefit is more difficult and would likely to require further investigation.
Yeah, concerning the next subject is role of motivation. The video game-based therapy is often considered engaging and motivating for patients. Based on your research, did you find evidence that patients' motivation plays a role in therapy effectiveness?
Thank you for your question. We really hope to find such an answer, but unfortunately, this article did not provide one. But after exploring the topic in more depth, we conclude that further neurophysiological assessment would be needed, and we also hope that regarding our article, someone will be inspired and take this idea further.
What about combining the traditional and the modern rehabilitation approaches? Your research evaluating these novel rehabilitation methods, and could you include this kind of rehabilitation into conventional physiotherapy? And I don't know your relation. I know relation with Peto Institute in the past, but not nowadays. Could you implement this method, or are they open to take this kind of rehabilitation method and combine with this conductive education in Peto Institute?
Yes, thank you for your question. We also we can see that for robot-assisted gait training there are a lot of logistical hurdles. For example, it is expensive, hard to access, and difficult to standardize. However, by recognizing the positive elements of both approaches, we could combine them to reach a more comprehensive rehabilitation program.
Do they know about this at Peto?
No, not yet, unfortunately.
Yeah, they have quite a nice conductive education, worldwide known, world famous, but they are not perfect as well, so they should be open to accept all new modalities, I'm sure. Age-related differences. Were there any age-specific differences in the effectiveness of the therapies you analyzed? Different age groups?
Unfortunately, regarding the limited number of papers, there is no any additional information about age-related effects of these innovative forms of therapy.
What about the future directions? Based on your findings, what do you think is the most important research gap in cerebral palsy rehabilitation that future studies should address?
Future studies should contain a more homogeneous patient population and more additional randomized control trial to get more insight into this topic. And can you repeat the question again, please?
Based on your findings, what do you think the most important research gap in CP rehabilitation that future studies should address?
I think these things, yes.
Why do you think you couldn't take more patients in? You mentioned somewhere that the limitation of your study is not so many patients. Is the prevention better in Hungary nowadays? Obstetrics, most of them are gone. More careful births.
I think due to the study types, which we used only just randomized control trial, and maybe the study type could be a limitation for these intervention programs, or could be a reason, or it could be in the background that there are just a few articles about these topics.
Okay, thank you very much. I have two questions in all subjects, but I'll let you carry on, and if we have time, then I can have more questions.
Thank you very much. First, congratulations for your topic selection, because it's very interesting and definitely points to the future. The first question, as you described in your thesis, the functional improvement can be visible in these patients, but on the other side, the functional impairment can be visible as well because of joint deformity or contracture or even decreasing neuroplasticity. So the question is, could this method prevent this effect by influence neuronal pathways and can make longer the period of time in which they could be used effectively?
Yes, thank you for your question. Yes, this rehabilitational tool is suitable for range of movement increase and to increase the strength, also increase the strength. And maybe further investigation we needed, which used more longer intervention periods, because the limitation that I have not said yet was that only a few weeks they have investigated the.
So maybe, okay. If I understand correctly, the main advantage of video game-based therapy is that children can do it multiple times. No need to make an appointment with a physician or physiotherapist, right?
Yes.
Okay. Can this method be applied independently or only as an additional therapy along with conventional physiotherapy or treadmill training?
Yes, the main advantages of video game-based therapy that the patient can do it at home without any physiotherapist, and through the increased compliance, it can be resulted better or a more comprehensive rehabilitation program. As for robotic-assisted gait training, it's a little bit different because robotic-assisted gait training needed physiotherapists to do that, and it's more expensive, so there is no any chance yet to do it at home.
Okay, the robotic training provides improvement in gait speed. Yeah? The overall amount of improvement can be visible in case of comparing to the physiotherapy instead of the treadmill training. So it seems to me that the treadmill training is more effective, right?
Yes.
What do you think could be the reason?
When we have started the research, we thought that physiotherapy is more treadmill training is more close to physiotherapy than robotic-assisted gait training. But after the research, we think that robot-assisted gait training is more close to treadmill training according to the effects on gait speed. And we think the reason could be that with treadmill training the treadmill training has almost the same effect as robotic-assisted gait training, and that's why we can see that if.
So the robotic training could be an additional therapy along with physiotherapy?
Yes.
Okay, thank you.
Great, thank you. Any questions from the panel or from the floor? We have two bonus questions, right? Let's say. Very good. Yeah. But there is a question.
Congratulations, brilliant. topic, brilliant talk. My question is about, it's very clear that they will have some functional improvement during the intervention. So my question is, if they stop for any reason this kind of intervention, do the functional improvement going back to the same part, or some of them still with them for their entire life? Or how long does it take to decrease the functional ones? Have you seen any studies about what's happening if they stop the intervention?
Thank you for your question. Unfortunately, this article did not provide information, or in the literature we cannot find any additional information for that. Its long-term effects and how long can it improve these parameters.
What do you predict? What would your hypothesis, if you do a study, and I would be your statistician, what would you think about? What would be your hypothesis?
We think that we can perceive the benefit effect at least until the therapeutic time we used. After the therapy, of course.
Yes, please.
Okay, thank you. So I'm not an expert in orthopedy, but and my question is not directly related to your topic, but please let me allow to ask it. So cerebral palsy particularly occurs due to hypoxic damage during labor and delivery. But at this early stage of life, the newborn doesn't play with video game and cannot walk and even cannot stand up. So what kind of intervention for rehabilitation can you apply at this early stage of life?
Thank you for your question. At this early stage, of course, we do not have this chance to use these new forms of therapies, but the general neurodevelopmental therapy we can use, and with other usual cares.
Or maybe you can apply the robotic-assisted movements. Or I don't know what is the situation with the electric stimulation of the muscles to prevent the muscular atrophy.
Yes, thank you for your comment. We can use it, use them, as have you said.
Thank you very much. That was my question about age-related rehabilitation processes.
May I just ask you something? Because I mean, you've been working on that project now for 4 years.
Yes.
And have you treated these patients over the last 4 years regularly, or?
We can see patients at our ambulance who have been treated with these forms of therapies, but we are a little bit skeptical about that. So,
exactly,
yes.
Exactly, and that goes in collaboration with Tamás's question. I mean, it looks so hopeless to me. Even the positive results of your study reveal very, very minute improvement.
Yes.
So that's doesn't look very promising, does it?
Yes.
Yeah. We should be so grateful to Mátyás to choose this topic, being orthopedic surgeon. You are going to be orthopedic surgeon.
Yes.
Are you postgraduated? Not yet?
Yes, I have a professional exam, which I have taken at Lazio.
Yeah.
Okay, any other questions? No. Then you have the 2 bonus questions.
So I haven't mentioned my questions from the topic of barriers. Besides cost, what do you see the barriers to implementing robotic and gaming-based rehabilitation in more clinical settings?
Yes, thank you for your question. Although cost has become less barrier in Hungary, where a few robot-assisted gait training centers now are funded by the National Health Insurance, the biggest challenge remains the accessibilities. These therapies require a significant time commitment, and only a limited number of patients can be accommodated. And it's also create logistical hurdles for family who often need to travel and find an accommodation during the treatment period.
How could you make policymakers to be interested in this subject? What do you think?
I think the biggest barrier remains the financial aspect of robot-assisted gait training.
I'm going to tell you, if they have a child with CP, then you can involve them. Yeah. Otherwise not, unfortunately.
That wasn't the highest level of conclusion, but at least, but this is a sad story. It's a sad subject. Any other questions, comments? If not, we let you go, Mátyás, right?
Thank you.
Have a rest, and we will be back shortly.
Okay. Thank you.
For the last announcement of today's PhD defenses, and we have had a very good day because we grant Dr. Mátyás Vezér a PhD. We will suggest to receive the PhD degree with a 97% agreement. So congratulations to you and Tamás, the supervisor, and let's congratulate.